I'm Dr. Anthony Cave, an anesthesiologist and integrative medicine specialist here in a real-life operating room where I get inspired by patients on beds just like this, connected to ventilators like you see here, in their most desperate, stressful moments. And I would be lying if I didn't say that some of those patients have inspired me to not only be a better doctor, but to take better care of myself and even help me when I'm feeling less than ideal. And I want to go generation by generation for what different patients bring in to this operating room and what it shows about how much we can take control of our health. And we'll start with Gen Z. Oh, hey, Alexis, thank you for that super thanks. Very kind of you. Let's start with Gen Z, the stereotypical generation that always comes to me before surgery, kind of like with a little bit of a know-it-all attitude. Once again, stereotypes, not all of them, but with this classic distractibility, because they're the generation, they're the digital nomads, they're the ones who've always had instant gratification, intermittent reward, constantly since their adolescent years, whether it's through social media, online shopping, whatever. Now, other generations also have access to this, absolutely, but Gen Z's had it for the longest period given their lifespan. So when Gen Z comes to me, the trend is that they often come with a distractible mindset. Not all of them, but when you're distracted before surgery, you're on your phone as I'm doing your IV or I'm doing your nerve block. You're not looking at me, giving me eye contact when I'm trying to go through what to expect for the anesthesia. Well, it's hard to have expectations. When you have unrealistic expectations, how can you be at ease with yourself? So many Gen Zers wake up with a lot of delirium for many reasons, but partly because of this intense distractibility in moments when calmness, peace, understanding, and expectations should be set with their doctors. But it's the Gen Zers that buck the trend, who use all of their digital tools to set up realistic expectations, to come to me and ask the right questions. And the number of times I've been asked a question and I'm like, I've never thought of that before. What an awesome question. Those are the Gen Zers that often are able to come out of their comfort zone, not be distracted out of fear, which is totally reasonable before you come into the operating room, but be able to dig in to curiosity. We'll talk about that in a second, but be able to leave their comfort zone, attain a sense of confidence because they are prepared. Okay, they have all of the world's resources at their fingertips and they're less distractible than the other Gen Zers that get stuck up in cute puppy and kitty videos, which, dude, I'm also victim to as well, but they can have a handle over it. I'm not saying they're better than other Gen Zers, but they impress me with their questions, with their understandings, and how they wake up focused on their healing. They're often waking up grateful, as opposed to waking up in this whole me. Oh, my stomach hurts. Oh, this hurts. Oh, I'm so afraid. Not that those are wrong. They're valid, but they're not equally valuable. Linda, thank you so much for the super thanks. I really appreciate that, and it's very kind of you. So Gen Zers that wake up so almost with a Jedi Zen-like calmness really impress me, because given their lifespans and relatively fewer experiences compared to other generations, are coming out like little Jedi masters out of anesthesia. And I am just so taken aback by it. And I see this way more often than you might expect. Number two are the Millennials. Before I go there, just to remind you, this is live, unscripted, and I really appreciate your support as I do these live streams. Anything that you learn, please share it with others. Remember that you have a lot more power over your health than you've ever been told. So if you can inspire your loved ones and friends with these stories and this knowledge, please do so. If you hit that like button and support what I'm doing, it also is much appreciated as well. I don't like to do any brands or product placement. You know, this is about knowledge for you. Hey, Marcia, hey, thank you for the kind super thanks as well. Millennials. So Linda's asking, she's a millennial. Usually it's after 1980, the ones that got social media a little bit later in their adolescence compared to Gen Zers. I see a lot of fear. Everyone can have fear, but millennials are old enough to sometimes seen their parents and grandparents go through a medical setting. They've seen bad things happen. They may have medical PTSD either from their own experiences or from the experiences of loved ones. Of course, any generation can have this. I'm just generalizing for millennials here, but the unknowns, the fears, the doubts that ultimately lead to anxieties can flourish before surgery. Hey, Sheena Collins, thank you for that super thanks. It's very kind of you. Now, when we sink to our worst before surgery, we don't come up with like exemplary behaviors. We come into the most often inwardly focused, ruminative and perseverative loops. If it's of the past, we call it depression. If it's of the future, we call it anxiety. And when we get stuck in these loops, you can imagine that it's harder to come out of it. So maybe before surgery, if you already have a tremendous amount of anxiety, it's going to be harder to bring yourself out of it. It might lead itself to kinesiophobia after surgery, right? The anxiety around movement. Patty Hoffman, thank you as well for the super thanks. Karma and Mochi will very much appreciate the treats. But when you are stuck in this loop of the inwardly focused perseveration and rumination, remember that humans have an innate way to come out of it. We call it curiosity. Millennials often, like any other generation, will fall into the curiosity of deprivation before surgery. Now, this is in contrast to the curiosity of inspiration. What's the difference? Curiosity of deprivation is when you have to figure something out because you're afraid if you don't figure it out, you're in trouble. What's the answer to this question on my test? What's going to happen to my body under surgery if they can't find this? Or you see how it's like, oh, the classic. Who was that actor on the TV show? What other movies have they played in? You can't rest until you figure out the answer. Versus those that have curiosity of inspiration. When we are curious, like, why is the sky blue? It doesn't matter. By the way, these are one-way see-through, so no one's seeing what's going on in here. When we have curiosity of inspiration or genuine interest, it doesn't matter what the answer is. We find pleasure along the journey. Deprivation, curiosity of deprivation is when we can't sit still until we figure out the answer. So when millennials come, and they've seen enough to be a little bit afraid of medicine now, a little bit vulnerable, recognizing the mortality of their bodies. They're not like the invincible teenagers anymore. They know that there's a ticker on this heart and it ain't gonna go forever. It's easy to be like, Doc, what are you gonna do when you open me up? Doc, what's gonna happen with the incision? Doc, what are you gonna see inside my knee, inside my abdomen, inside my chest? Very valid questions. Versus the millennial that comes and says, Doc, what do you see inside my body? What does my larynx look like when you're putting the breathing tube back there? How am I gonna feel when I wake up? You see how it's two totally different views. In Rain Girl, these are normal, but the mindset that you look at the curiosity with will influence how you're gonna wake up. The curiosity of inspiration, genuine, like, what are you gonna see inside of me? Can help raise millennials or anyone out of that inwardly focused, perseverative, or ruminative loop. And those are the millennials that are so, it's fascinating. When they wake up from anesthesia, they're literally like, Doc, what did you see? What did it look like? What color was it? What did it smell like? Versus those that wake up, what did you find? What was in there? Was it scary? It's like just the tone alone, the anesthesia almost opens it up to make it even more exaggerated or more dramatic. So when that curiosity blossoms up, that's in a way that demonstrates that you're really here for you really want to learn genuinely. What did the doctor see? That is a setup for less anxiety and recovery and a better healing experience. Once again, I'm not saying it's wrong to have the other curiosity. They're all valid. They're not all equally valuable. Now, number 3, boomers. What happens when boomers go under anesthesia, and what are the ones that really inspire me? I first have to give a shout out to Stephen Rapp. Thank you for that super thanks. You say, my father was a surgeon and my brother an MD/ER doc and a lawyer and 2 nephew doctors. My dad practiced till 92. My other family members believed even years ago under treatment of chronic pain. Stephen, if there's a question in there, I'm happy to answer it. But under treating chronic pain absolutely can lead to sickness of the mind and body, and since they're connected, can make either one worse. Linda, Dove, I'm wishing you the best, and I hope everyone here is sending you positive vibes after healing from your shoulder surgery. Jojo Granum, I didn't see your question. I apologize. It's hard to keep up with all of them, but I'm trying to look it up. Jojo, Gen X are not boomers, and I'm not saying that they are. I'm going to talk about boomers that lash out to me as a younger physician before surgery, because boomers have seen a lot more than Gen X, have seen more than millennials. They've seen their parents probably pass. They've seen loved ones in really bad situations. They themselves have more chronic conditions than any of the other generations. And often, at least I gotta say in the last month, a handful of boomers that lashed out at me was from a situational anxiety. When anxiety gets amplified, it can turn into frustration. Frustration at the situation, so it feeds into a vicious loop. The more anxious, the more frustrated at the situation, and the situation won't change when you're frustrated at it unless you change the situation. We'll get to that. And then this builds up in the hours and the weeks and the months leading up to surgery. When you have frustration that is gone on steroids, it turns into anger. And with enough time, that frustration boils into anger, and who does it come out at? The most vulnerable person there. Just like how we talked about power differentials, when doctors, narcissistic behaviors in doctors at least, or arrogance in doctors, or any power differential, whether it's in a relationship, whether it's with coworkers, who gets the short end of the stick? The ones that are vulnerable. Women, people of color, immigrants, young people, etc. So often it rains on me. That is not alone, and that's not just boomers that do it. Everyone can do this, but the boomers often have more wisdom than other generations, because wisdom is knowledge plus experience, and they have more experience by definition. And it's the boomers that catch themselves 5 minutes, 10 minutes later. They say, Doc, I'm so sorry that happened. I just realized that X, Y, and Z was why I lashed out at you. It wasn't you, but it was different factors that have now changed their mindset. Now, I didn't change the situation. They're still having surgery, but it's this magic formula, even before they get anesthesia, by the way. It's this like formula of the stress of surgery, trusting a doctor, and even before the medications go in that will grease the wheels, they have the maturity, they have this wisdom that helps them connect dots in ways that they often don't do outside of the stress of surgery. Sometimes they wake up after surgery and they apologize after the surgery is over. And it's like, the situation really hasn't changed. You still had surgery, but something in this process brought together all of the wisdom that they've accumulated from a stressful situation, but being able to trust a doctor in that stressful situation. Almost like a psychedelic experience, by the way, when you're talking about ayahuasca, ketamine, mushrooms, etc. And helps them completely recognize that their mindset can change the situation. I'm going to say that one more time. You might not be able to change the external events in the situation, but when you can change your mindset, you can change your situation. And those are the boomers that impress me so much, because I just watch the transformation over 1, 2, or 3 hours. And I'm like, dang, I hope one day I can be that strong, psychologically, call it spiritually, wherever resonates with you. And they tend to just have more experience than the millennials and Gen Zers to be able to pull that off, especially under stressful circumstances. Eleanor Contillo says, hey doctor, what do you do if you know someone is addicted to OTC painkillers? Well, Eleanor, that's a good question. Over-the-counter painkillers, so we're not talking about kratom, we're not talking about illicit substances, we're talking about non-steroidal anti-inflammatories like ibuprofen and acetaminophen or paracetamol. I usually don't have patients addicted because there aren't very many dopaminergic circuits activated by NSAIDs, non-steroidals, or acetaminophen or paracetamol. So usually the problem is that they have kidney damage or gastric ulcers or bad acid reflux from the NSAIDs, and then that can actually lead to a need for surgery or to different anesthetic techniques. As with any addiction, you got to recognize, why is the addiction there? Addiction is not so much a diagnosis as much as a symptom. It's a symptom of seeking something, as Gabor Mate says. So you're not an addict. You are someone seeking something that the addiction is temporarily soothing. Very good question. Hey, Jojo Granum. Yes, Gen X 65 to 79. We are 44 to 56 years old. Jojo is asking, are we the most depressed and apathetic? No, the most, this is way beyond the scope of this conversation, because first of all, we don't know what generation has the most mental health burden, because there's just too many variables that go into it. We need to see if millennials, when they're in their 40s to 50s, have more mental health conditions. We have to do a comparison at the same age, right? But we do know that Gen Zers are more likely to speak up for mental health. We know that millennials are more likely to seek mental health treatment. But we also know that Gen Zers are more likely to grab sleep aids as well, more likely to self-medicate. And we don't even know really who else is using illicit or recreational drugs, because it's often totally underreported. We know that Gen Zers, for their mental health and their depression and apathy, are more likely to use weed as opposed to alcohol, though that's rapidly changing. We know that the boomers typically go for alcohol, but I've just seen too many boomers really not own up to their recreational marijuana or cannabis use either. So I don't think we can really say who's more depressed, but we can say that boomers have more wisdom to be able to overcome these situations when they're supported internally and externally. Great questions. So I wanted to just remind you all that all generations under anesthesia have so many things in common, but when you buck the trend, I gotta say, you inspire me to be a better person. And when I've been struggling through so many things, seeing Gen Zers teach me things, who are people younger than me, when I see millennials teaching me things, I am so inspired. And even the boomers, as crotchety and old and whiny as they are sometimes, hey, all generations are. Some of them tend to lay it out on me more, which I don't appreciate, but they can still teach us so much, especially when the anesthesia is about to kick in. Till next time, you have more power over your health than you've ever been told. Oh, I missed the exit button. Sorry about that. I feel like a boomer now. I thought I hit the exit button and I totally missed it. Take care, everyone.